This video introduces you to the PollexBox. This measuring device was developed at Erasmus University in the Netherlands and was originally called the Pollexograph, but here in the US it's called the PollexBox. As you can see, it is indeed a box. The lid opens and inside it stores the laser line light that you use to line up, and a pair of protective goggles come along with the laser line light. Many individuals use goniometric measurements for traditional thumb abduction measurements, but there is a lack of precision in that because the position of the CMC joint can actually alter the angle. The PollexBox allows you consistent, reproducible positioning that allows accurate, repeatable measurements. The group in the Netherlands did develop a set of norms, and the norms and the articles describing the use of this are all on our website, www.handlab.com. Now let's see how this works. The first step in measuring is to take the patient's thumb and to make 3 marks that are anatomically based. The first mark is in the center of the thumbnail. The second mark is in the middle of the MP joint. And the third mark is at the CMC joint. Now, if you have trouble knowing exactly where the CMC joint is, take the first metacarpal and flex it, follow that down with your finger, and you can literally feel the condyle at the base, and my fingernail has just marked the CMC joint. You can feel the space between. So we have these 3 marks. The next step is to take the patient's hand and position it precisely on the PollexBox. The thumb CMC mark should be lined up with a 90-degree angle, fingers flat against the side, forearm flat against the side, and the thumb across the top of the box. Now, we're using a rod because the laser line light will not show up, and you can see we're a little too far this direction toward me. So we're backing off a little bit until we get that lined up just exactly. Now that's the starting point, and we don't move from that point. Now I ask the patient to bring his thumb as far this way toward me as possible. Great. Don't move, hold it there. Then I would take the laser line light and I would line up with these 2 marks, the CMC and MP mark, and that would tell me that he is just about at 43, 44 degrees of abduction of the first metacarpal relative to the second metacarpal. So this is the metacarpal abduction measurement. Lining up with those 2 and seeing what number lines up here. Now I ask him to bring his thumb out, again, just to be sure. And what we're doing is we're looking at the thumb tip and where it falls. This now is the full thumb abduction measurement, and that's 50 degrees. So you can appreciate that that is greater, certainly, than the abduction. Now, you don't use a laser light on that one. You simply see where the mark on the thumb fingernail lands. Now, having done these measurements actively, we simply do the same thing passively, and I would passively abduct his thumb. I would use the laser line light once again and line up with that, and I see that I've gained about 3 or 4 degrees on his normal thumb. And then I would do the same thing on the thumb tip, but I'm able to bring him to 58 degrees versus his original 50. So you are able to measure both thumb abduction at the CMC joint as well as what we call full thumb abductions. And if you go to the website at handlab.com, you'll find the norms available for both adults and children.